So hi guys, today we'll be talking about atypical antidepressant. So what is atypical antidepressant? Okay, atypical antidepressant are a type of medication which acts in an atypical manner but similar and relatively similar to most types of antidepressants. It is a mixed group. It is a mixed group of agents that acts on several sites. Okay, so atypical antidepressant eases depression by acting on chemical messengers which communicates within the brain cells. Its major action is elevating or causing changes in the level of these naturally occurring chemical messengers. By this, it eases depression and it causes stimulation. We will look into an example of atypical antidepressant, which is bupropion.
Okay, going on with the mechanism of action of bupropion. So the neurotransmitters involved in this mechanism of action is dopamine and noradrenaline. Okay, and action potential in the presynaptic neurons will cause the vesicles to bind and release dopamine and noradrenaline into the presynaptic cleft. Dopamine and noradrenaline will bind the postsynaptic receptor sites, resulting in an action potential. Most of the neurotransmitter will be reabsorbed into the presynaptic neurons via reuptake pump. Once reabsorbed, they are stored in the synaptic vesicles or degraded. Bupropion is a noradrenaline and dopamine reuptake inhibitor. Bupropion inhibits the reuptake of dopamine and noradrenaline by blocking the reuptake pumps. Okay, it will block here. Okay, on the presynaptic neurons. This will allow for dopamine and noradrenaline to be left the synaptic cleft for longer, leaving them to bind the receptor site on the postsynaptic neuron, creating the antidepressant effects. We look into the uses of bupropion.
Okay, so after looking at the mechanism, now we're going to look into the uses of bupropion. Okay, so two major places where this bupropion is very helpful is one is in depression. Okay, why depression? Is because it is a drug which increases our mood, it lifts our mood up, it eases depression, it stimulates our minds, and it also increases our focus. When you're comparing bupropion with other antidepressants such as SSRI, SNRI, and TCA, bupropion is as similar to it and is better than the placebo. But it is superior in terms of the side effects, where it does not cause sexual dysfunction, and it also doesn't increases our appetite or stimulus to eat, reduction in overweight, and also it is not as drowsy as other drugs, other antidepressant drugs. So it is also used in treatment of SSRI-induced sexual impairment. Okay, so now next we're going to be looking into smoking cessation. In smoking cessation, bupropion is useful because it is as similar to the therapy of nicotine replacement. It is started from the second week of the smoking cessation therapy after counseling and may be continued prolonged to as long as months as possible. It is effective once you start administering yourself with bupropion. It takes up to 4 weeks for that max effect, and treatment can continue on for months. So that is one of the major uses of bupropion. It is also used in ADHD patients as well as obesity patients. So next we'll be looking into the side effects. Why coming so fast?
Painful lah. Hey, what's the problem? Why you do my pen now? Huh? Why you do my pen now? What did you do with my pen?
Okay, so as mentioned in the uses, we're going to look into how bupropion is indicated for treatment of major depressive order in adults. So okay, we start off with 150 mg as an initial single dose in the morning. Okay, so once administered, the time it takes for the medicine of bupropion to show its antidepressant effect might take to 1 to 3 weeks, as mentioned before, and sometimes the maximal effect can be seen on the 4th week. Once after 4 weeks, the dose may be increased to 300 mg per day, given as 400 mg 4 times a day QID, if well tolerated, with at least 8 hours of interval per administration. Okay, but however, there's only a maximum of 400 mg day given as a 200 mg BD leavage. Okay, once done, we should reassess the patient's condition periodically to determine if the individual needs to continue treatment. The use of lowest dosage maintains the remission.